So the NEC Society's PCORI Research Prioritization Project brought together patient families, clinicians, researchers to identify the most urgent and impactful questions that are really mysteries in the NEC field. And we built a team, and together we went through a 2-year-long process to identify which questions remain, which questions have been answered, but perhaps not adequately, especially to patient families, and to begin to prioritize them and rank them so that we know where our field should be directing the very limited resources and funding that we have to the questions that really need to be answered the most.
Collaboration with patient families through this research prioritization was a lot of fun. One, meeting a number of different patient families, hearing about their stories, but most importantly, collaborating and trying to understand their perspective when we're looking at a research problem that often is very focused from a scientific or medical perspective.
I was able to work as part of the team that was determining which NEC-related research questions are most important and most impactful. And it was a very exciting team because it was truly a team of equals. Patient families worked alongside NEC researchers and clinicians as one team, and patient families were fully empowered to understand that their experience and perspective was equally as important as the scientific experts.
Collaborating with patient families is absolutely terrific. You get to hear the patient and family perspective. For NEC survivors that have grown up, it's really important for us as neonatologists to get to see them and how NEC has affected them, 10 or 20 years down the line.
And this is powerful because patient families are able to ask questions that clinicians and researchers may not even think about, because we've been in the units and we've seen what it's like to have a child live through or perhaps pass away from this really devastating disease. And so there are things that as families we think about or we've experienced that really can influence the research process in a very different way.
I'm a patient, as in I have multiple chronic illnesses, so I'm always at the doctor's office. And I'm very used to this kind of power dynamic where even if, for instance, they've never heard of NEC or NEC's long-term outcomes, they still have more authority over my body story than I do. And my voice is usually not seen as something that has much value. I'm not always believed in that space, and I feel very disempowered. So all of a sudden, I'm in this room with these clinicians, some of the nation's most talented clinicians, and I'm being told, okay, these are your peers. And not only that, what you have to say matters, and what you have to say about your health matters. And for me, that was mind-blowing, but I had to get used to that a bit.
Often in scientific research, the perspectives of the people who are most impacted, that's the patient families, are left out. And no one else, no matter how much training or education someone has, you can't understand unless you've been through this experience. So it's really important for patient families to be included in research in a real way, because no one else can replicate our thoughts and our perspective.
Perhaps the biggest challenge that we really didn't anticipate was just how difficult the process was going to be for many of our patient families. And so doing this work when we've personally lost a child to this disease is painful, and it has the potential for re-traumatization. And I think prior to engaging in this work, we didn't really understand or appreciate how difficult it could be for especially bereaved parents to be asked to really think about the research questions that we don't have the answers to, but if we did, they could have saved their child's life.
Their stories are incredibly impactful and sometimes heartbreaking. And I think the power of stories of getting and acknowledging sometimes the grief that you experience, but also the motivation it provides for people like me who study NEC to really feel like we've got to figure out ways to solve some of the challenges and experiences. And I think that has been one of the experiences in terms of what it's been like.
The most challenging part of this project for me is the fact that so much remains unknown about necrotizing enterocolitis. So I spent a lot of time thinking about what truly matters to patient families and let that guide me. But it's very difficult to make a prioritized list when you feel that everything is important. But we got there as a team.
NEC is a complex disease. There is not just one cause. and there's not going to be just one solution. And so it takes all of us to really be creative in terms of how we're going to solve this really difficult, complex problem of building a world without NEC.
I'm really hoping that projects like ours will encourage a cultural shift towards including patients in these conversations about how to best help us, elevating patients' voices, making us feel more empowered, and just including us in these conversations.
The power of community cannot be understated, that what we need to do more and more if we all want to have better delivery of healthcare to our babies and our children is to build stronger community that revolve around specific conditions and just a better platform where communication occurs at all levels from the beginning to the end.
The key takeaway points from this project are really that we can unite diverse stakeholders from the different communities within NEC, and we can work together to collaborate on research that matters most to our community. We can integrate the patient-family voice, and by doing so, it makes for better, more effective research.
I hope that researchers in the field will hear us and will take up this list of prioritized research questions. And I hope that researchers will involve patient families in their work. I often think of the phrase, nothing about us without us.
The NEC Society is not just an emerging organization, but one of the strongest patient-centered organizations in neonatology that certainly I've experienced. I think the organizational strength and the growth trajectory of this organization is really going to lift many boats in our field. Great engagement with patient families and tremendous integration of patient-family voices.
Now that we've built this prioritized research agenda for the NEC community, we need you to get involved. You can join us at necsociety.org.